Well, my name is Megan Leslie. I am the CEO and a co-founder of NanoTess, and we're a Calgary-based company. For those of you who don't know us yet, NanoTess is activating skin and wound healing through catalysts. On the screen, you'll see 3 QR codes. They link to videos that show how our technology has impacted health systems, communities, and everyday lives. If you want to learn more about our technology, NanoSelf, please visit our booth to learn about its impact and its adoption across Canada. Because in today's session, we actually aren't going to teach you about this technology, but rather we want to leave you with a mindset and a conviction that with an innovation approach, each of us individually can contribute to making Canada a leader in healthcare. To help me on this journey, I have 4 wonderful panelists who will walk you through the foundations of an innovation mindset. I'm joined by Dr. Dante Mora, former Chief Clinical Innovation Officer for Trillium Health and founder of the Can Health Network, and Rosemary Hill, a clinical leader at NSWAC in BC, Dr. Robin Evans, Medical Director of the Wound Healing Clinic at Women's College, and Michelle Smith, a former provincial healthcare leader at Alberta Health Services and now a clinical leader at NanoTess. So, to kick things off, I'm excited to introduce Dante Mora. Dante, can you walk us through your journey with Trillium and what inspired you to establish the Can Health Network?
Great. Thanks, Megan. So I started as the inaugural Chief of Staff and Executive Vice President of Research and Innovation at Trillium Health Partners when the hospital merged. So led the hospital through the merger, through COVID, through a whole bunch of different parts of setting up research and innovation and education at Trillium. And for this room, when I started, our incident rates of wound care across the platform, and Trillium is one of the largest hospitals in Canada that takes care of 1 million people in Mississauga and West Toronto, were 8%. That's really high. And working with an outstanding colleague, Catherine Hayward-Murray, who was the Chief Nursing Executive, we were able to get that down to about 3.3%. Every one of those point percentages really matter as a group. So I'm really proud of that work, and I'm a practicing internist. So Trillium as a platform that changes healthcare is a really powerful one, and use all the tools to be able to do that: practice, education, research, and operations. But what I started to see was that the importance of actually aggregating the whole country together to drive innovation was really important. So we created Can Health, which is 50 organizations across the country. Those organizations represent about $180 billion of purchasing and procurement and adoption power. And what we do is we find problems in the market, and then we find great companies that are solving those problems, and we connect them. NanoTess is one of the companies that we came across, changes wound care through their technology, and it's been adopted across the country. What our mandate is to use the $400 billion of spend in Canada to drive Canadian commercialization and adoption and innovation at scale. And we do that by using the organizations across, and we're really proud of the work of this Calgary-based company and how it actually changes healthcare, changes the results and the wound healing, but also drives prosperity and jobs. That's a little bit of the story.
I think what Can Health is really inspirational because, let's face it, Canada's great at research, but we're not very good at innovation. And what I mean by that is if research doesn't reach a patient, it's not really innovation. An example, a Canadian example actually, is insulin was discovered in Ontario and commercialized by Eli Lilly and then Novo Nordisk outside of Canada. These companies make billions of dollars a year, earnings which are not reinvested back into Canada. So Dante, fast forward 10 years from now, what would Canadian healthcare look like if the strategic vision of the Can Health Network was not achieved?
Okay, well, we are achieving it, so I'll take it to a bit of a positive. We've done about $700 million of procurement across. But what it is like you're seeing the tectonic plates of healthcare hit each other, supply and demand. So we have too much demand for not enough supply. You all know that, you're clinicians, and you're seeing that play out in the public system. Our only way forward is for us to actually activate the commercial, entrepreneurial, and innovation economy and drive prosperity, jobs, tax revenue, creating more innovations that helps us bend the cost and constraints of the system. The alternative of that is actually an erosion of our public system, the erosion of universal medicine, and the inability of our population to be healthy. health and wealth go together. And if we don't hit our mission as a country of driving prosperity and technological and innovation adoption and supporting our local companies and adopting their technology, then actually it's not a very good future. But I actually believe that's not going to be the case. I think we're just on the beginning of a Canadian renaissance. And that doesn't mean there's not amazing companies in the US and amazing products from elsewhere, but we have to adopt our winning technology and our winning companies and do it at scale, and that's what we're doing. So, thank you.
Thank you. So I want to jump over to the West Coast here to hear from a clinician that has started this work. So the BC Skin and Wound Value Analysis team just completed their evaluation for NanoSolve. And Rosemary, you took part of that evaluation. So I'm curious if you can walk the audience through what did that look like and what was the result?
Sure. So I sit on the, there's two committees for British Columbia. There's the Skin and Wound Committee, but there's also around our practices, but then there's also the Value Analysis Committee specific to wound care products. And from time to time, innovation occurs, new wound care products come about, and as a committee, we decide, hey, this looks interesting. Why don't we proceed with an evaluation? So there's consensus, and then we have about 6 health authorities, and so there's a representation from each health authority in British Columbia. And we check in with that health authority and say, who would like to evaluate this product? As it so happened with the NanoSolve, there was a real interest both in the settings of acute care and long-term care and the community. And so we had a considerable number of evaluators, and then we created a tool, an evaluation tool, so that in each site they operated with that same evaluation tool. We were given a period of time, somewhere in the nature between 4 to 6 weeks. Product was sent to the various evaluators, and then we reported back. Shannon Hanfield is our lead for British Columbia, and she tallied the results and then presented them back to us. And at that point, we made a decision with our Value Analysis Committee to proceed with adding the NanoSolve on formulary, and hence, as I mentioned earlier, there is the product information sheet on the CLIC website related to NanoSolve. Through the evaluation, there was, we made it clear in terms of the wound types that it was used on. And so it wasn't just a big pot of evaluations on a whole variety, but there's a very clear process on where there seemed to be an impact on certain wound etiologies. Mm-hmm. We decided also, one last thing, I don't know if you've ever gone to that CLIC website, but it's grouped into categories. But with this particular product, we had to pull out a new category of a catalyst, because it wasn't a gel, it wasn't something that was around autolytic debridement, but rather it is in the catalyst category. So we established a new category.
Thank you. And I know Alberta Health Services ran a similar evaluation to get the product added to their formulary back in 2023. So now that it's on the BC formulary, what advice would you give clinicians across Canada?
Well, yeah, I think it's interesting because Alberta has adopted NanoSolve, and so has BC. And so that's, as you can appreciate, that's a considerable number of, in our case, it's NSWOCs, nurses specialized in wound ostomy incontinence. And so I hope that would afford you some degree of confidence in that a number of people, wound care champions, have established that this is something they want to have readily available for their patients and in their practice. I feel like I'm still learning about how it works because it is really new technology. And so very much evolving at this time. But yeah, I would say there's we're not quite the population of Ontario, but Alberta and BC, we're getting near to 11 million. We're coming along.
Thank you. And Dr. Evans, I wanted to chat with you because when we were talking, you mentioned that there were 3 factors that you look at when you're exposed to a new innovation. Could you share those with us?
Sure, and I hope everybody here also sort of thinks about what they consider when an innovative product comes to their desktop. What do they think about? So I tried to break it down as structured as I could in thinking about, my clinician thing. First of all, what is the science? Do I really think this is reasonable? Is it safe? And is there any risk to the patient? So I think those are the 3 biggest clinician concerns. I also worry about the patients. How will it impact their activities of daily living? Is there any risk to the patients? Do they understand your use? And can you educate your patients about what you're doing? Thirdly, it's the system factor. And I think this is, I feel a little bit like the poor cousin in Ontario. Lots of other provinces have adopted this. And so, how accessible is it? I've been given samples of it kindly by NanoSelv and used it, and but can I keep going with this? Can I give it to the patient long enough to affect a change? So those, I think, are the 3 biggest factors for me. I think cost will always come into it. Is it a factor that's going to promote and ensure that this wound heals quicker? So cost is always a factor.
And you've shared with us a few patient stories. Would you mind sharing a patient story and how that's also helped you embrace innovation?
Yeah, so I've it's always important with wounds, as you all know in this room, there's no one product that's good for every single wound. You have to pick them very carefully. And I did pick a couple of them very carefully, and I'm still getting feedback on more. But one is a pressure injury, and I'm sure everyone could stand up and tell you that this is the hardest wound to heal, and I kind of cringe as they come into the office. But I had a very motivated woman. The wound was on the ischium, again, really difficult to heal. It was a clean base, and I'd been following it for a long time. She had great care, good turning, wonderful attendance, but it wasn't really pushing forward, and I got her to use NanoSelv, and she did come back. Not the next time, but I follow her every 6 weeks. But it did eventually heal at the second visit. She was extremely impressed, felt it was the NanoSelv that really moved things forward. That was very enlightening for me. And then there was another gentleman who had a venous leg ulcer, and as you know, they can be very, very wet, and I don't recommend necessarily putting on this as a soaking wet wound. But this one was at a point where it was managed, and he got some of the NanoSelv, and he ended up purchasing the rest of it and used it regularly. And again, it healed very quickly. And it's these patient stories that make me want to use more. There's more that are brewing in the background right now. And when I go back to work, maybe we'll see some more. But it's been impactful. And the nice thing about it is it's over-the-counter. Patients can buy it. They feel very engaged in their wound care because they're trying something new that's innovative as well. So it's been a plus for everybody.
Thank you so much. And we're going to move on to our last panelist. And before I get Michelle to speak to the technology, I think every great innovation comes with a change management process. And that's part of the work that we each have to do. I don't know if anyone's done the ISO update, but they changed the button and you have to do something different, and how infuriating and frustrating that can be. That's a lot of what we do when we're introducing innovation into a new setting, whether that be in a patient's home or in a clinic where each of you are present. And I think that's part of the work. So I wanted to tee that up because Michelle has actually, she was a former customer of ours before joining our team as a clinical lead. And Michelle has taken the integrating an innovation from concept to a provincial-wide rollout within her team in a really complex clinical setting. So Michelle, could you tell us a little bit about what that looked like and why you're excited to help others do the same?
Yeah, thanks, Megan, and thank you for the thoughts that you all have offered so far. I think it is a really nice way to segue how to sort of operationalize some of the innovation. So imagine, if you will, it's a cold Alberta day, and we have a lot of cold winter Alberta days, and a community paramedic is called to help someone living on the street struggling with a wound that simply will not heal. Now imagine inside the kit that community paramedic is carrying with them to help the person, there's something that makes decision-making a bit simpler. There's something that has the opportunity to change the entire trajectory of that patient's healing or their recovery. To me, that's the power of innovation. Not when it stays a pilot project or when it is in an evaluation phase over and over and over again, but when it actually becomes part of that everyday care. When I worked with AHS, I had the privilege of leading the mobile integrated healthcare team. And that team is a wildly talented group of community paramedics that are seeing patients in all kinds of settings. They might be on a street corner trying to help someone who's experiencing homelessness. They might be in a long-term care setting, or everything in between. And that practice environment was shaped by many factors that I'm sure you can imagine. Weather, space, cleanliness. On occasion, we had unwanted visitors that might be coming around to either help with care or distract from care, pet and toddlers, if you can imagine. When we were asked to integrate NanoSolve into our provincial program, on paper, it seemed really simple. But in reality, it was more like turning a ship into some really high winds. It was ambiguous, it was iterative, it was full of so many unknowns, especially from a community paramedic lens. There was no established playbook, and there was no clinical guidance for our scope of practice at the time. But there was desire, a lot of desire, because community paramedics are very, very brave clinicians. That desire to improve patient outcomes, to support caregivers and catalyze change was very meaningful and impactful. And so innovation in healthcare doesn't really ever fail because of the science to me. It fails because of the scale. So every team, every region, every clinician has some unique context. Policies, supply chains, some of the challenges my colleagues have talked about here. Even skepticism changes from day to day. And those are the real mountains that we need to climb, because if we don't climb them, it's going to be our patients that never get the opportunity to benefit from the technology that we can share with them. So after months of coordination, trust building, celebrating the small wins, there are now 40 community paramedic units across Alberta carrying NanoSolve in their kits and being able to use and access it as needed for any patient that they encounter in any practice setting that they encounter. For patients, the return has been enormous. Wounds healing, trust being rebuilt, dignity restored. For us in Alberta Health Services, the focus was really about avoiding hospital admissions when we could, if we could. And the clinicians and the feedback I was getting from my team was that they stopped feeling like it was kind of one more thing and kind of an annoyance or an irritation. And instead it became a way to unlock better outcomes and have a tool that was accessible in their hands. So when I think about the things that I learned from that experience, the small wins matter more than the big launches. Being able to do reinforcement, frequent engagements, and create space to share stories about those little successes that you're having was really the spark. Each story was a spark that lit the next one and the next one and the next one. And so when I saw that NanoSolve could succeed in the complex setting that mobile integrated healthcare and Alberta Health Services had to work within, I felt like it could succeed just about anywhere. I often think of change like wound healing in many ways. It isn't one single event. It's a cascade of carefully coordinated steps. If one phase stalls, then progress slows right down. But when each part works together, you have a chance to see some real transformation. That's why our NanoTess team is committed to walking alongside you. We want to support your education. We want to tailor your integration, and we want to help align innovation to your unique context. So innovation absolutely is in our hands. If we're all willing to ensure it doesn't sit forever in that pilot phase and that evaluation phase, then I think we have a real chance to make a difference for our patients, because we'll be making sure that not only that it reaches our patients, but that it keeps Canada at the forefront of healthcare excellence. So if you're ready to be a champion in innovation, I'd love to connect. I'd love to see you at our booth. And I'm here to absolutely help you on your journey for integration for any innovation that you're exploring within your healthcare contexts.
So we don't have time for questions. We have a booth. We have an educational portal which will go deeper into the technology. Just let us know. And there's 2 posters, one tonight and one tomorrow afternoon.